Hi, everybody. Why light therapy? We have lots of questions about photobiomodulation. And so we have baby Einstein, Marcie Denton on the screen with us today. It's hard to stump the panel with Marcie. And if she doesn't know the answer, she can find it for you. She is amazing. And many of you know her already, and you've been to one of our classes or her classes, or you've been coached by her. But the topic for today is really why light. And we know you have questions, so we're going to answer a bunch of them before you have the opportunity to ask us. And then we'll be answering some of the questions you sent in. So light outside the body, light inside the body. What's up with that? Specifically today, we're going to be talking about a pad-based system using light that way, and specifically InLight Therapy system. And we'll also be touching on the a new product for us, the MyElle Vaginal Light Therapy device, where we can put light inside the vagina for women's issues and sexual wellness. Our first question is, why go through the trouble of light therapy? Why photobiomodulation? I'm just gonna read some questions, the overview of what we're gonna be talking about, and then we're gonna come back and we're gonna have that discussion. The next one is, what does pain have to do with all of this in light therapy? Then how about chronic pain as compared to acute pain? How do we deal with that differently with light therapy? And we do. And how does light help post-COVID? That's the topic of our lifetime right now for most of us. Marcie likes to say, when we provide a solution to someone's concern, to someone's pain, to someone's crisis, stress, need, now you've really done something. And so we know what results we get with light therapy, and we can help to provide this for other people. And that's just really important. And then we're going to wrap it up at the end. I'm going to tell you now, but I'll probably remind you, Marcie does coaching with a lot of you all that will be watching the recording or maybe live. You're a practitioner in the healing arts and you use photobiomodulation. And sometimes you have a stump the panel issue or question, and you can go to her for coaching. So let's just start with the first question. Why go through the trouble of photobiomodulation or light therapy? Marcie, why?
Yeah.
Why should we do that?
Well, it's the answer. There is a quote from Dr. Inagro, who was one of the Nobel Prize winners in 1998 for discovering nitric oxide. And his statement was, we don't know anything that isn't related to health and wellness that isn't related to nitric oxide. And that was before he was discussing photobiomodulation and nitric oxide. So if there's a connection, it may be the connection that we want to talk about. It's a lot of trouble. My clients complain that it takes time. And I'm going, now I know why I want to really say, you've got to take the time, because we are aging every single day.
Well, you might be, Mars.
I might be. I know I am, and I know you are. So you can't get away.
I'm not claiming that.
Not you are claiming it. So what happens is our body stops producing natural nitric oxide as we get past the age of 30. So at 50, we're like at 50% of what we were making when we were younger. Well, what does that have to do with the trouble of using the light pads or whatever systems you're using? The deal is that light, red and infrared, release the nitric oxide that we make naturally from the endothelium. So it boosts our our tank gets full. You know, if you're thinking in terms of gasoline, you put gas in the tank and it's, you know, your little gauge goes, yeah, I'm getting there. Well, if you put light on every day, you're boosting your capacity of having nitric oxide, which does remarkable things for you. Nitric oxide continues to be a redox molecule, which means it's a part of the immune response. It's part of the huge part of the COVID immune response. But more than that, it's for everything. It's for what we come in contact with. It's how we deal with issues of tissue disrepair. I'm going to say, you know, it isn't like we hurt all the time, but we tend to ache sometimes as we're getting older, or when we're doing more active work, our bodies start breaking down. Well, if we add light, we are enhancing the natural capacity to produce this nitric oxide, or release it, I should say, and then your body can heal. And that's the key piece for why I've always said that light is a health and wellness technology, not just an intervention for, you know,
Yeah.
what ails you. That's
Right.
That's the short end.
And if we Google, now a verb, right? Google nitric oxide, and we look at all the physiological processes in the body that are supported by nitric oxide, the presence of nitric oxide, it's amazing. And I'll just look, I'll list off a few, and then if I miss some, Mars, then you jump in and say, okay, so a reduction of inflammation, an increase in circulation, a decrease in pain, increase in collagen production, increase in the release of osteoblasts. That's why there's so much research done on bone and fracture healing using photobiomodulation, because of the release of osteoblasts, creating phagocytosis, which means it creates an unfriendly environment for pathogens like bacteria, viruses, funguses, viroids, prions, etc. And the list goes on. I know there's a whole bunch I didn't mention, but if you just think, the healthier we are, the more, you know, when we exercise and whatever, the body is, and the younger you're saying, the body is naturally releasing more nitric oxide, right? So if there's something that we can do to release more nitric oxide and help the body to heal itself, then that's what we want to do. And we'll go back to, in the natural healing arts, the whole reason we're doing what we're doing, and in this case, we're talking specifically about light therapy, because we're wanting to work with the body's natural intelligence. And the body, as Hannah Kroger said, because she's passed on, but she was a great healer, a great teacher, name it, she was that. She said that the body was the most sophisticated computer that was ever designed, and that there would never be a computer smarter than the human body. Given the proper information and the proper encouragement, the body heals itself. Well, every living thing needs light, right? So if we're flooding the system with light, we're giving the body the information it needs to heal itself. And some of that information is also nitric oxide. Did I get it?
That works.
Okay. Okay, so Marcie, then what about pain? And what does pain have to do with all of this?
This was a topic that we actually discussed this past week, or maybe it was this week. It just seems like time runs on. But injuries that are that we've spent a great deal of time, in my experience with light, with the FDA clearance for pain and circulation. So the nitric oxide component is, you know, a huge component. But really and truly, for a while, we were just working within pain, and we were just working within the issue of circulation, because that was our clearance. And not to go into, crazy detail, but because we've been around for so long, we've proven to the FDA that photobiomodulation is safe. So they've taken off the requirement for clearances in 510Ks and show me it's safe, etc. Now we're under the umbrella of a safe, really healthy living device. I mean,
That's
it's a
huge.
game changer. It's a game changer.
That's huge, because we've been doing this. Some of us and some on our team or our colleagues have been working with light therapy with animals for 30 years. And I've been working with it, 12 years or 13 years or whatever. But to have to do that dance and have all that history behind us to get to the place where, even though this is considered, most of these devices are considered a class 2 medical device, the reality is it's a wellness device, and the FDA recognizes it like that, as that, how safe it is. That's huge. And that opens up, as you said, our ability to talk much more freely about the benefits, the wellness benefits of light therapy.
And therefore, we're still going to talk pain.
Of course.
Yes. So in the coursework that we put together and presented, we address two kinds of pain. And I know that for some of us, pain is pain. No, pain is not just pain. If it's something that is immediate, you just twisted your ankle, we call that acute pain. It has a completely different way of, or different need for light. If you twisted your ankle 6 months ago and it's still hurting, that's a completely different way the body needs light. So if you, as a practitioner or just an owner of a device, and it says it's good for pain, well, why isn't it working like I want it to work? That's a complaint, especially for chronic pain. Acute pain, put it on where it hurts, and generally you get relief and you get it fast. But for chronic pain, the body is resistant. It's
Right.
resistant to the information. And so the difference between the two is that the body is accepting the information to reset its use of oxygen. Now, what does that have to do with pain? That's the issue. When you are injured, the tissues that you've injured by natural event, this is all part of the body's response to injury, blocks the use of oxygen, and inflammation sets in and pain sets in, and the body responds to the need, sending in white blood cells and fluids, and all it's going 911 on your ankle. That's great unless it stays there too long.
Right.
That's when we talk about the chronic pain, when it's just not being efficient. It's done its job and now it's hanging around. It's like rent free in our body. Hey, stop. You've
Right.
done your job. Go away.
Right. Right.
So the difference would be, if it's an acute issue, then you put light on the injury. And my recommendation is that you never let the pain, which it goes away a little bit, don't let it get as high as it was the first time you put light on it. So the timing of using light is very different. It's like, if my ankle starts hurting in 2 hours, put the light back on.
Marcie, I'm going to stop you there just to underline what you're saying, because because I think we learned this, what you're teaching, over time by working with thousands of clients, right? And because in the beginning, 10 years, 12 years ago, whatever, we would just say, well, 20, the systems, and there are the different systems, and we're not, if you have a different system than the ones that we have, you use those. Light's good for us, and there's, good products out there. But most of them will turn themselves off after, say, 20 minutes. And so we were sticking with, 20 minutes or maybe 40 minutes. But we learned over time exactly what you're saying. So say it again.
Well, and you don't have to do 20 minutes to get the relief for that injury. So as you're adding more often light, you can add it for less time, because you're dealing with the tissues that are still being ornery.
Right.
The other tissues are already functioning better, so the pain has gone down, but you don't want the system, the body, to escalate the pain, because then you're just redoing. You're doing, and then you're doing, and then you're doing, and it's, the body isn't healing. So you want to stop the pain from getting worse. And it's a ladder. And there's some pictures, probably if you were in our course, we have a ladder where you go, oh, we're going to go between, we're putting light every 30 minutes. Oh my gosh. But we're only putting it for 10 minutes.
And I like to think about it as, with chronic pain, you really are having to retrain the body. And so if we think about going to the gym and, working out, you don't want to do all the reps at one time. You have to rest between reps.
And you have to let the light work in a different way for chronic. So for acute, what you're doing is you're interfering with the production of pain. You're stopping this, how wonderful it is that if we put light on an injury, it resets the use of oxygen. That's the simplest way to say, how does light help with pain? It resets the use of oxygen, which then reduces the inflammation, which reduces the pain. So advice, use light a lot, or use light often, and you don't have to use it for the 20 minutes. You can use it for 10-ish, 5-ish as you get through this, and then pretty soon you're establishing a regular use of maintenance, which would be every 4 hours maybe. So eventually you get to a maintenance setting. So acute means action, A for action, and you go after it. And you use the benefits of time and light to talk to your body really efficiently. Now,
okay, go ahead.
If the ankle, if you didn't do this and your ankle is still hurting after 6 months, where do you put light? And the issue is the body now has adjusted in a way that is not helpful. So there is a pain mechanism that happens in the spine, and it's almost like a memory. So it sets up this memory that it's going to keep sending the message of pain to your brain. So not only do you want to put light on the injured ankle, you want to put light where those nerves go into the back, because that's the messaging part of the pain that makes chronic so difficult to manage. And this is a very simple process. You kind of figure out where those nerves go into the back, and you put light there, you put it on the injury. And if you really are interested, you can put it at the back of your neck if you don't know where those nerves are going in. So then that messaging gets actually interfered with. the brain feels the pain, not the ankle.
So
If you can
Marcie,
stop the message.
if they don't know where the nerve is in the spine, then how might they find that out?
Well, they can look at a dermatome, but they can also put it at the neck.
I was leading the witness. I was trying to get you to say, look at a dermatome chart. And
Well,
where can they find a dermatome chart besides an
look at Google. Google it.
Zoom. Oh, it was Google. Yeah, Google. Right.
But that's why I said the back of the head, because then you're catching all the nerves, going to the brain. That's I know that may be completely off the charts for some of you, but I think it was such a good question this week that I hadn't thought about in a couple of years, probably. So anyway.
Well, as far as dosing, like how much light, I know I learned a lot from watching my own children when they were really little and as they've grown up, to see that, and animals, and hearing stories of others, animals, is that they might have a terrible bellyache, put a pad on their belly, 3 minutes later, they're good and they're gone and they feel fine. Or maybe it's 10 minutes later. So I know I learned a lot by observing animals and children. And so I like it, as we've learned over the years, and you've taught us about the chronic pain issue. It just makes sense to me finally that we're not blasting the chronic pain in the same way that we would do acute pain, just as a highlight here. Because in chronic pain, we really have to think about it more as a retraining of the body. So very good. And okay, so now, because of the time we're in and the whole COVID situation, how does light help post-COVID?
I am the principal investigator for an approved study, and I've sent in, as of yesterday, a revision of that studies to include post-COVID individuals with post-COVID. The original study was just on inflammation and light therapy, the pad systems that we use. And why I chose that was because we knew a year ago that COVID was an inflammatory disease. We didn't have any idea what happens with people who have COVID. I didn't know anybody with COVID. I didn't have any experience. There were no research articles. It was a blank. There were 2 research articles, I take that back, that I found. Anyway, so that's probably not a year. It's probably 15 months. So one of the things that has happened is a blooming of understanding the value of photobiomodulation for COVID. And yesterday, just when I looked up another topic, there were 4 major meta-analyses of the research that's out there that other people are doing with photobiomodulation and COVID. We have, Kate, Aubrey Shemaine, and I have put together a website for folks who just want to know. And if they have light, how to use light if they have COVID, but if they don't have COVID, prevent COVID. And if they did get COVID and now they've got post-COVID, we've got that on there too. But the study, eventually, you guys, if you know anyone who is still experiencing post-COVID, as soon as I get the stamp of approval, I will open it all up and Ginger will know and she'll get it all out there. But what we found out is that the beauty of nitric oxide for COVID is huge. If it's good for us to be healthy, if it's good for us as a health and wellness molecule, my goodness, what it is for COVID. So the beauty of light therapy and nitric oxide. But let me talk first about red light. The nanometers for red light destroy or denature or make, useless the spikes of the COVID virus. It literally, if you put red light in your nose, if you've been exposed where the virus will replicate and then go to other places in your body, that's where you get sick, is in your nasal cavity. And that consistently is the truth. In other words, we keep looking at it going, is this still right? Is this still right? Is this still right? And the answer is yes. The virus replicates within the nasal cavity. So putting red light in your nose, if you've been exposed or if you've been in a situation of you're concerned and you have the capacity to put red light in your nose, it will reduce the viral load. And therefore, you either get less infected or you don't get infected. We're not sure, we haven't done that research, but we do know that the spike is denatured by red light. So
And I want to jump in and say something, but I don't want to interrupt your train of thought. So we're going to finish that thought?
it's a transition, we can do it.
It occurs to me just now that when I had COVID in November, most of the month of November, we already knew about COVID for 7 or 8 months, okay, because it came out January, February, something like that, beginning of 2020. In the beginning of 2020, I had gone to have dinner with a friend of mine this was February, I think. And we were just learning about COVID, okay? It was all, and she had been terribly sick in January for like 6 weeks, January, beginning part of February. So she was sort of said she was over it, and we thought she was over it. And so we went to have dinner. But she was still at dinner, she was still kind of congested and everything. And I remember thinking, well, whatever this, I don't think she had COVID, but whatever she had, I don't want to get it, especially this time. And I was a little bit, I was just a little concerned, and because we were sitting, in close proximity to each other. And so I came back home, and a couple hours later, a couple hours later, maybe it was the next day, but I think it was that same night, I started getting the chills, and I couldn't get warm. And then I started having a couple of other little symptoms. So I thought, oh my God, if it's this thing and it comes to the nasal passage, I went and made myself, I have a colloidal silver maker. So I went and made myself some colloidal silver, and I'm snorting, literally, snorting it with, it's in water, some colloidal silver, but putting the light therapy pad on my face, because we know that, like you said, it comes through the nasal passage. And what we want it to do is, so my eyes, once I finally ended up getting COVID, months later, like maybe again, who knows if it was the second time, but the first time I knocked it out in just that day. But we know that if we catch it in the nasal passage, as you're saying, it won't drop into the lungs. I was really concerned that it would drop into the throat, then into the lungs. And so I knew enough about COVID at the time to know that you got to catch it up here. So I was on lights. This is, I'm not telling anybody to do this, but I was on the lights for hours, knowing that I just wanted to sort of fry it and not let it drop into my lungs. So I ended up the next day, I felt absolutely fine. Now, I don't know for sure that I had COVID. I might have been some other flu virus or cold or whatever, okay? But my point is, we've learned so much since that time about exactly what you're saying. What I'm sharing is, if we've been exposed, boy, we want to make sure that we're catching it here.
Well, let me talk about prevention. So if your nitric oxide is up if you filled your tank because you're using light on a regular basis. Nitric oxide becomes, believe it or not, the primary immune response, because if COVID gets out of your nasal cavity, it attacks the interferon system, which is our normal way of making antibodies. And I call it, it clips off. And one of the one of the presentations I've made, the article, the research article says that it snips off the protein, and I call that protein the 911 call. So the interferon system cannot say, help, make a fever, make mucus, cough, do something, act like you're sick, because you are. No, it just lets you go by the wayside. You're just doing fine because your immune system is not responding. Nitric oxide has to take over. It is, as we've said before, a very aggressive molecule toward viruses. And COVID is one of those. The coronavirus, it's very aggressive toward that virus. So it begins, if you've already saturated yourself with nitric oxide and you've been exposed, you've got a chance not to get terribly sick. Now, I'm going to say for the record, you could get very sick, depending on your comorbidity, depending on a whole lot of things. This isn't like, the answer is all here. It's just that the experiences that I've been hearing about for elders in particular, 85, 83, closer to 90, use lights 3 times a day. If they got the time, they use them. And not for COVID, just for health and wellness. And they had like minor COVID symptoms, never post-COVID. So we know that people who are using light efficiently prior to infection seem to be able to manage it. Not that everybody can, but it seems to be a really nice intervention. So we recommend it as an intervention. But if you have COVID, what does the light do? Besides activating the nitric oxide and enhancing the nitric oxide to be the immune response, it is extremely valuable in knocking down inflammation. The body system's natural way of addressing this environment is to go bonkers with inflammation. It escalates all the cytokines that are for exactly inflammation to take out the virus. I mean, it's the attempt to deal with the injury that we have, the infection, but it overreacts. And so we end up with a cytokine storm. Our lungs have been contaminated and deteriorated because of the damage it's done. The endothelium gets damaged by the virus. I mean, it's a mess. And you end up with serious breathing issues, etc. You put light on a person, but prior to this damage, even after the damage, and there's a huge how do I want to say this? The inflammatory response is muted. It doesn't, not that it doesn't happen, but it doesn't make the cytokine storm. There is an article that has a diagram. It's the first diagram I ever saw in all of my research over the last 15 months that demonstrated if you don't have light, you get the cytokine storm, all of the major implications for that. If you have light, and they called it photobiomodulation, and they had a little picture of the light shining on the body, reduction of inflammation, reduction in cytokines, prevention of the cytokine storm. Basically, you stay healthy and well. The very first article that captured the value of light and COVID, I mean, it's on the website, it's on my brochures. It's so critical as the turning point of knowing that we have something very, very valuable, not just for health and wellness, but now we have something, you know, we got to keep washing hands. It's not a bad thing to keep, you know, spreading the droplets. If you know, that's not a bad thing. It's not a bad thing to get vaccinated. It's not, you know, there are lots of things that are good. Well, guess what? We have something that is very, very good, and that is light.
Yeah, and I want to say, I've said it on some of our other programs or webinars or whatever, is that when I did contract COVID in November, you know, fast forward from whatever, February to November this past year, I had gone about 3 weeks without using my lights, and which is very unusual for me. But I was trying out a new brain device that Dr. Norman Shealy, who was the head of my graduate school and just a neurosurgeon, incredible physician. And so I was just trying on this device, and I had it set up at the same place that I usually have my pads just out. Plus, my dog had, my new puppy had eaten one of my light pads. They were yummy. So that was an expensive lesson for me to not leave them out at that time. So those things, I mean, I think I was supposed to get COVID so I could have the understanding of really what a person goes through if they had I sort of had a medium case. I've had some people who, you know, had it. One of my youngest sister had it, felt crappy for 3 days. You know, mine was knocked out in the bed for 3 weeks. I didn't lose my sense of smell or taste. I didn't ever have, you know, real difficulty breathing, although my oxygen level sometimes would drop. But I felt like hell. And it took me months to feel, you know, normal again. But the point that I'm making is I even knew that I needed to keep my nitric oxide level up, you know, in my body during going through the pandemic, and I got lazy.
Your coach
Don't be lazy.
was telling you.
Don't be lazy. You know, and again, I mean, you know, people watching this program, some of them have different pad-based systems, and or they have panels, you know, or whatever. Use what you have, but for God's sake, you know, get that nitric oxide release in the body. Use your lights, you know, use your lights.
But you brought up the issue of post-COVID.
Yeah.
The damage to the tissues of the body are not known in their complexity. It's a mystery, so much so that the NIH has funded over 7, they call them centers of excellence, as post-COVID clinics. They're trying their darndest to figure it out, and I'm jumping up and down on the calls with them, going, "You got to try lights. You got to try lights." Yeah. They don't know yet the value of light. Right. So they know the difficulty of post-COVID. So the damage, one of the articles that says that COVID is a circulatory disease, not a pulmonary disease. And I took that article and I printed it 500 times, you know, blew it up big enough that, you know, you could see it a mile away. They discovered, you know, I'm going to say this, it's important. What we know today is what we know. It's not wrong because we find out something tomorrow. Right. It is the linkage to tomorrow. So when we have been told different things about, you know, hand washing or distance or masking, and you go, well, it's, you know, some people get really upset that they change their mind. Well, we value what was information that we had, and it was as good as we knew today.
Right.
And if we don't use it for tomorrow and clarify and learn, we're not doing the job of managing this particular pandemic or anything. The beauty of science is that it uses what we know to go where we don't know. And that support, knowing that science is always refining what we know, makes it very valuable and not wrong.
Right.
It just means that we have to keep working at it. So anyway, COVID is the more recent understanding is that it attacks the endothelium of the circulatory system first. Goes from the pharynx to the larynx into the circulatory system. Where does it go after that? To the lungs. Yes, lungs are one of the first indicators. But
isn't this why, because of what it attacks, isn't this why we have some people have issues with blood clotting?
Absolutely, but it's weird blood clotting. It's in the brain when everybody else has, like blood clots in the legs. I mean, this is something they are just blown away trying to figure out. But it seems to be a trigger for it metabolically and genetically that they may have an answer, but I don't know what it is. So I'm not going to go there, but they're working on it. It's a mystery right now. But here's the other thing. The endothelium is what makes the nitric oxide.
Yeah.
So the aggressiveness of using light is important because you want to keep your endothelium healthy. So it's like, what is it that's going to help you? The endothelium that makes the nitric oxide. Well, if it's being damaged, we got to take care of the prevention. Use your lights.
Okay, and so I'm just going to remind us, and then we're going to wrap it up, but answer the questions that came in the chat. So I'm wrapping it up, reminding us what Marcie said is that when you provide a solution to someone's pain or condition, their stress, their need, then you really have something, and we do have a solution. I will also remind you, that Marcie's available for coaching. You were about to say something, Marcie.
Yes, there's in the chat, the website. I did not give it, so I will now. The website with the information on COVID InLight is COVIDlightTherapy.com. Okay,
and then we're also going to show some of the InLight systems. We're going to show them the MyElle Wand. But do you want to just and we're not going to be talking about panels today or any of the other torches or anything, because we already are into our time, but we do intend to have other programs where we're talking about some of these other devices that all of us are using, or some of us are using. I would say for myself, these are the two that I'm using the most, a pad-based system or the MyElle wand. So Marcie, real quick, do you want to just distinguish for us between the two types of devices and when you'd use?
Panels give you the option of a lot of coverage usually. There are people who love their panels and they're becoming more and more sophisticated. Like we've always said, can we just get in a bodysuit?
Yeah.
and to some extent, there are very large panels that clinics have, and that you can actually get in like a tanning bed that are red and infrared light. I don't have a lot of experience with panels. I just have to say that if you love them, you love them. And if they bother you, you don't keep using them. Sometimes they're You have to be at a distance. So the power of a panel is different than the power of a pad. So you can't take a panel and put it on your skin.
Right. And the thing
the jewels are different. And your distance, they'll give you parameters on how close you need to be. Pay attention to those, or you're not going to get enough light, or you might get, maybe it's too much. I don't know. I'm not that experienced, other than we have people who love panels and they have shared that. And I would like one to play with, to tell you the
okay,
truth.
well, but you're not answering my question. Right. I know you think you are, and but distinguish using, which is great, because that was great information. That is great information. But why use a pad-based system? And why use the MyElle wand? Just,
Oh, the MyElle. Oh, well, it seems to be a solution to incredible female stress and distress.
okay.
It continues to amaze me at the response that we have received from new owners of the wand. I don't know if I knew how much the vaginal health issue was a major issue of intimacy, their health, feeling of personal wellness, being really, anytime any system is not functioning normally, you're put under stress. It's a stressor. So it influences all of your being. And this seems to be such a remarkable gift for so many women.
Right. And I'm going to jump in and say, I've been a female all my life.
It happens.
My whole life.
That way.
And honestly, I had no idea the different kinds of problems that women had with their reproductive organs. I mean, of course, and I've worked with, health with the ovaries and the uterus and all of that, but being introduced to the MyElle wand and working with it, seeing what's happening on an energetic level, as well, and all the cellular memory, as well as simple things, odor or cramping or prolapsed organs, etc. We don't have a lot of time to talk specifically, so we're not going to. But we're going to talk a little bit right now about a pad-based system, and specifically InLight. But what I want to say right now is Marcie and I have recorded quite a few webinars, lots on light therapy, as well as, I've done some biofeedback and some other things. And then, I've done some on understanding energy, etc. Go to our YouTube channel, Energy Events and Products, and you can see a lot of the stuff that's out there. We're going to continue. I like to keep filming Marcie, because Marcie's just incredible with the wealth of knowledge that she has. And I also, want to start doing some interviews with some of you all. Now, having said that, go back to the person who sent you to this webinar, told you about photobiomodulation or light therapy, and transact your business with them. We're not in a competition with anybody, even if we sell the product. If we're the one that introduced you, yes, then come to us. But our practitioner friends often send us their clients. So, go back to them, and you've got that relationship with them. And a lot of those practitioners were our students. Having said that, the co-founder of our LETS program, Light and Energy Training Seminars, which is how we prepare people for light therapy certification, the three co-founders, myself, Marcie, and Isabel Martinez. And Isabel's in Mexico, and she sells, if you want to transact business with her on any of these devices, then contact Isabel if you need her information. It's just info@myellemexico.com is the only one I have memorized of her email addresses. Okay, so now let's talk about putting light against the skin, as in a pad-based system, Marcie, and InLight system. Now let's talk about that for a second, and then I'm going to show these on the screen.
Okay.
We got to go quick because we have to stop the recording.
Okay, I'll wait.
No, we have to wrap this up.
Oh, you do the wrapping, or unless I can do the wrapping with the pads.
Okay, so I'll just say that with InLight system, many of you all have that already. I have systems that we bought 12, 13 years ago. They're still going strong. David Malone's been producing this equipment for animals and humans for, I don't know, about 30 years. It's been a work in progress. We've been, along for that ride for a long time. We have used other light therapy products too, so we know a good product when we see it, and they just keep on ticking. So if you don't have a pad-based system, we highly recommend that you get one. And now what we're going to do is just, I'm literally going to show you, for those of you all who are just being introduced to photobiomodulation, I'm just going to show you, give you a visual of the different systems. So here we go. These are, you're looking on your screen right now, these are the InLight package options. And there are many, or you can design a system yourself. At the bottom here, on the bottom left, you see a boots. Those are considered boot pads, but they can be used anywhere on the body. We use the wavelengths, and most of the light therapy companies out there use wavelengths of red, infrared, and blue. And so that is what InLight is using. But there's more to it than that. There are additional frequencies. The reason we use the different wavelengths is the depth of penetration. There's also, as I said, frequencies. It even makes a difference, the angle of the light coming out of the pad. And we know from research that the closer the pads are to the skin, the more the release of nitric oxide. Anything you want to say to wrap it up on InLight there, Marcie, before I show the MyElle wand?
The fact that you can manipulate the pad to fit body parts is wonderful. Personally, I think the boot, we call it the boot, but I consider it to be one of the most important of all the pads that are in the system. It's very flexible. It can be used around the neck, down the back, around the head. I mean, it's awesome. That's
yes. I love the boot too,
speaking.
Because it is such a versatile pad, and you can see in the different system packages an assortment of pads. We have a number of webinars already, but talk to your practitioner or go visit our YouTube channel or whatever, and you can learn more about these. Now let's just go on over to the MyElle. This is what the MyElle wand looks like. First time I saw it, it's like, oh, that's a sex toy, and it's like, okay, well, we won't say you can't use it that way, but it does have light coming out of the tip and off the sides, and it is a wand, so you do insert it. The wavelengths are red and blue, and for specific reasons, as we've been going over. And it's incredible, the results that we are hearing from people. I had one of my colleagues and friends and customers of about 30 years called to order one for her adult daughter. And she said, if the only thing that had happened for her out of using it was that her incontinence was totally cleared up now, that was enough for her. And, another person that said she had an odor issue for 10 years, and that it was a real problem for intimacy with her and her husband, and he's a physician. And he verified that this was all the case.
after a few uses that the smell was completely cleared up. So light makes the difference. Light encourages our body to heal itself. It's information, it's some of the information the body needs to heal itself. So I don't think there's any other questions. And we just want to thank you. Share the link. You will let people know about this webinar and our other ones. We appreciate you sharing that information because we want everybody to lighten up. So Marcie, thank you. And
You're quite welcome.
everybody, thank you. Keep it light, everybody. Bye.